be talking about eating disorders in male collegiate athletes. Eating disorders aren't really something that is talked about a lot, especially in males, so I want to try to bring some awareness to that today. And my PICO question is looking at different treatment options and trying to figure out which one would be the best. So the prevalence of eating disorders vary. It ranges from 0 to 19% in male athletes, and it's even higher in females, but like I said, it's not really talked about in males at all, but they do happen. And the most common one is bulimia nervosa. And people with bulimia nervosa usually excessively worry about their weight and their shape. And some symptoms include dietary restraint, excessive exercise, purging behaviors, and then most of these things stem from the attempt to control their weight and shape. So some evidence from some articles I found. Athletes who self-weighed 7 times per week reported the most pressure to lose weight and to be lean or muscular. They were more likely to be engaged in muscle-building behaviors, they dieted the most often, and they had the highest level of bulimic symptoms. And then athletes on teams that conducted these mandatory weigh-ins were more likely to have these symptoms. And then weigh-ins should be voluntary, but they can cause a concern with the appearance and body shape because you're bringing awareness to that number they see on the scale. And this can lead to a number of behaviors relating back to the eating disorder and the change in their body. So nearly 1 in 4 of these athletes showed disordered eating behaviors. And again, this was associated with body image dissatisfaction, and athletes with higher body fat percentage were more likely to be dissatisfied with their body image. And I was looking at extreme weight control behaviors, and there wasn't really a difference found between competitive and non-competitive male athletes. And then overall, the greatest symptoms of eating disorder and other symptoms related to disordered eating were found in baseball players, cyclists, wrestlers, and rowers. And then when it comes to runners, males definitely reported higher levels of weight suppression, and they also looked at compulsive eating behaviors. And so there is a correlation between weight suppression and compulsive eating, but this is greater in males. If they have elevated weight suppression, then they're probably going to have compulsive eating patterns as well. And then this treatment of eating disorders in males, it's critical to look at the weight suppression when you're looking for treatment, because that's generally the stem of the problem. For treatment, we are looking at cognitive behavioral therapy versus physical exercise and dietary therapy. And they are both treatments for binge eating disorder or bulimia and other eating disorders as well. And then one study that I found was looking at cognitive behavioral therapy, and it was used as a treatment for patients with anorexia nervosa, bulimia nervosa, binge eating disorder, and even undiagnosed eating disorder patterns. And so cognitive behavioral therapy looks at thoughts, actions, and feelings and creates a cycle to try to get the treatment. And it involves having the patient confront their feared eating and body-related stimuli, and then they promote safety eating behaviors. And so there's a lot of evidence to suggest that cognitive behavior therapy is most effective in adults and older adolescents with eating disorders, but both treatments focus on normalizing eating disordered patterns, correcting basic self-regulatory processes, reducing idealized aesthetic evaluations and self-worth, and they've both been found to be effective. They just depend on the availability of what professionals you have at your fingertips. But I would say, from what I've read on cognitive behavior therapy, that would probably be the best treatment option. And so that answers my PICO question, but I also just want to kind of raise awareness on eating disorders, in particular in male athletes, because again, it's not something that is often talked about, and we need to look at how they see themselves and how that could, and how we see them, and examine the concept of muscle dysmorphia as possible eating disorder as well. And there's a need for openness and awareness to try to help these athletes. And as athletic trainers, we're the first line of defense for these athletes, and we could do our part in being there to help prevent and treat these athletes for eating disorders. And then also we can help the coaches be more aware of these behaviors that they might be creating in their athletes, and work on more prevention strategies starting from there to kind of nip it in the bud at the beginning of the process.